and welcome back to Scrubs Anonymous.
Today we're going to be talking about anemia, which is a manifestation of another disease process. So it is not a disease in itself, but rather a characteristic of another disease. And it can be from a deficiency in number of red blood cells, the quality of hemoglobin, or hematocrit.
And depending on what's exactly happening in your body, there's the same manifestations of anemia, but different things can be happening. So one of those would be decreased production of red blood cells in your body. And there's a few examples of this. And the first is iron deficiency anemia, and this can be the result of blood loss, or it can be a dietary problem. But specifically, what's wrong with you is that you're not absorbing iron, or you're not intaking enough iron to be absorbed. And so when they do your blood counts, they'll see you have anemia, and then they do a specific panel, and it shows that that you have iron deficiency anemia.
And the next one is thalassemia, which is just a genetic deficiency of red blood cells. They're just not being produced enough, so that results in thalassemia.
And the next one is megablastic anemia, and this is where the blood cells that you're producing are really big, and you would think that's better because they're bigger and you're getting more oxygen, but in reality they're just more fragile and less effective, and so they're just taking up space, but they're more likely to be destroyed. It's a lot easier to destroy them, and they're not as effective, so you're still going to have the symptoms of anemia.
And then we have aplastic anemia, which is a deficiency in all red blood cells, and it's also called pancytopenia, and it also is a deficiency in bone marrow elements.
And then the last one under this category, oh, we already did that. So the next category would be blood loss. So you could have a decreased production, or you could be losing blood. And of course, this could come from a lot of different areas, but it could be, the two categories are acute or chronic. So if you had like a sudden hemorrhage and you lost a lot of blood, then that could cause anemia because you don't have enough blood in your body. And then, or it could be chronic over a long period of time. Maybe you're not all of a sudden losing a bunch of blood, but menstruation or something, over a period of time, you're losing enough blood that you become anemic. And that's one of the reasons that it's more common in women than men.
And then the next one is increased red blood cell destruction, and one of the common ones in this category is sickle cell anemia, and this is where the blood cells sickle, but this comes in crises. So something sets it off where the blood cells sickle and are destroyed abnormally, and this is also genetic. So some things that could set it off are infections and things of that nature.
And sickling is where it changes shape, so it's not effectively absorbed. Each cell is kind of like curving in, right? Mm-hmm. And so it's not as good of an absorption site because it's changing shape, and again, like kind of like megablastic, it's just less effective.
So these people have a lot of pain because those sickled cells can't travel through capillaries like they're supposed to, so they get trapped in the capillaries.
So they'll have like shoulder pain or something. It's often localized in a specific place for a certain patient. It always comes and they feel like pain in an area because of the sickling. And then acquired hemolytic anemia. So this could be from trauma, it could be from infection, or it could be from like an immune reaction, antibodies, so just depending, but you acquire it over a period of time.
And then the next, which is miscellaneous, is hemochromatosis, and that is increased iron absorption, so your body's getting too much iron, and
And then polycythemia, is that how you say it?
Yeah.
Polycythemia, you're having too much red blood cells. So with both of these, that can be a problem. It's not like more iron is better, more red blood cells are better. Once you have too many, it starts becoming ineffective. So if you have too much blood, you think it's going to become thicker, and it's not going to get to your peripheral as easily, and so you have the same signs and symptoms of not having enough because new oxygenated blood is taking a longer time to get there because you have too much blood in your body, and so you're still going to have the hypoxia and different same kind of anemic symptoms with the opposite problem.
Okay, so the next thing is hemostasis, and this includes thrombocytopenia, which is a decrease in the number of platelets defined as less than 150,000. You can also have heparin-induced thrombocytopenia, which is people who are on long-term heparin therapy can develop thrombocytopenia because of it.
And then hemophilia is defective coagulation. So with all of these, you're going to be watching for bleeding.
And then disseminated intravascular coagulation is serious bleeding or risk for bleeding due to abnormal or accelerated clotting.
And then neutropenia is decreased neutrophils.
And these people are at risk for infection. And then you have myelodysplastic syndrome, and this is a change in the bone marrow elements.
And then you can have spleen disorders. So you can have splenomegaly where the spleen is larger, and because of that, it's filtering more, and because of that, you're going to have decreased red blood cells in the body. So having kind of overproduction of the spleen doing its job so much that you have decreased production or remainder of red blood cells.
And now we have some overall treatment. You can have autotransfusion, which is where they take your own blood before a procedure, maybe a few weeks before, a few months before a planned procedure, and then they give you back your own blood during the procedure.
And the reason for this is because with regular transfusions, which a lot of people with anemia have to get, there's a lot of reactions that they could have. They could they could have a reaction to the blood. You have to find the right blood type, ABO compatibility. All of that goes away when you're receiving your own blood, because obviously you have the blood type of yourself. So that problem goes away. The problem of finding blood, the problem of having a reaction to the blood or contracting a disease from the blood, all of those problems, is just a lot safer. So that wouldn't apply to everyone. If you had a blood disorder that they found when you came into the hospital, they couldn't take your blood and give it back to you. But if you knew you were going to have an operation and they're trying to prepare so that if you need blood, if something goes wrong, then they can take your blood so that they're ready whenever you come out of the operation or if anything goes wrong.
And some of those reactions include acute transfusion reactions, and that's why you have to monitor the patient while this is happening, because they can have acute transfusion reactions within like the first 30 minutes. And then you have delayed reactions, which include the risk of like hepatitis, receiving hepatitis from the blood transfusion.
And that would happen, you would see it later, but the acute ones, that's why you stay in the room with them and take their blood pressure at 15 minutes, things like that, or watching for signs of a problem.
So now we have our 80 pi, so we have assessment. So some things you want to assess your patient for is fatigue. You want to monitor their blood pressure as usual, their pulse. But people with anemia will portray signs of fatigue, and they can't really function normally.
You're going to want to look at their lab values. Those are going to be very telling. I actually had a patient one time that their blood levels weren't that low, so it wasn't, when I was looking at their chart just on the blood levels from that day, it wasn't that interesting, but it was at 11.2, I believe, but if you looked at the day before, it had dropped a considerable amount. It was like at 12.5 the last time they took it, and it had dropped to 11.2. They discovered that she had a problem with GI bleed because they saw that it had dropped, and not just because it was outside of the normal range that you think of.
And
and another thing that you can check for is looking underneath their tongue, and if it's white underneath their tongue, that's a sign of severe anemia. So in addition to looking at their blood counts, you can see how it's affecting their peripheral because they're not getting enough oxygenation.
And some diagnoses, a major one is decreased tissue perfusion or ineffective tissue perfusion, even impaired gas exchange if they don't have enough blood cells to carry that oxygen.
And then planning and implementation. So it just depends on the level that your patient's at. A big thing that you want to be doing is finding the source of it, because as we talked about, anemia is a manifestation. So you want to find, are they losing a lot of blood? Are they not intake? Is their diet the problem? Is Do they have like a chronic disease? You know, what the reason is for it. So that's a big thing that will result in being able to create a plan and being able to implement, because some of the interventions are going to be giving them a blood transfusion, and some of them are just going to be, you know, you need to be eating more spinach or change your diet or whatever.
Mm-hmm. And then evaluation, of course, you're going to evaluate if the treatment is working. Do they experience less fatigue? Are they alert and oriented? And do they have enough circulation to their body?
So reevaluating their blood levels, things like that. If they received iron injections, rechecking and seeing if those made it through their body, because iron takes a long time to really like actually change your lab values if you're on it. So checking your iron later on, and even months after, and just seeing if that circulated all the way through, and if you're back at a normal level, how it's affecting them, and if they're able to perform self-care and back to normal level of functioning.
And that's our video for today, and thanks for joining us, and I hope you have a great summer.
Last video.
Today we have a special guest with us, and she is a huge fan of our channel, and actually we have two special guests. She's also bringing another huge fan on with her.
And so without further ado, we'd like to introduce you to Abby.
Hi fans. Okay, this is Formaggio and this is me. Been huge fans since before the channel even started, and we just want to encourage you to watch it. We watch it to put ourselves to sleep every night. Watch this channel and